All right. Hi, guys. I just wanted to pop on here really quick and film myself doing the OSCE so that you guys would get a really clear sense of what the process looks like when it's really organized and what you needed to do to meet all those points. And then that way we can do our redos and we can do our conditional pass meetings this week. So I'm going to start. I've got my scenario just as you guys had. So when you walk into the room, you want to start by looking at your scenario. So the first thing I want to do is I'm going to wash my hands and I'm going to verify that the transcription of the doctor's orders is correct. So I have Ashley Miller's physician orders here and I have her MAR and I'm trying to make sure that everything is transcribed correctly over to the MAR. So I have Ashley Miller, the date of birth matches and the PHN matches. I see here she's got an allergy to cefazolin and she's got an allergy to cefazolin here. Her diagnosis is diabetic neuropathy pain, so she's having some pain and she's diabetic. I want to make sure that the order has been transcribed onto the MAR correctly. So I see that the order date was 06/05/2021 at 5:15 in the morning. That's the date that's wrote in the top of the MAR, but that's not today's date. The medications that were ordered were metformin 500 milligrams PO every morning. And I see here metformin 500 milligrams PO every morning. It's going to be at 8 o'clock. And today is the 8th of April. It hasn't been given, but that doesn't matter for transcription. The next one that the doctor's ordered is fentanyl 50 micrograms IM once daily. We have fentanyl 50 micrograms IM once daily, and they've put it at 0800. I see that Dr. Bluff has signed his orders and that the orders were processed by Joanne McDonald Watson. So they've been processed. So now I'm done ensuring that my transcription is correct onto my MAR. I'm going to take my physician's orders and set them to the side. Now I'm going to start my MedAdmin checks. So I need to do my writes and checks. And I'm going to need Ashley Miller's sticker to do that because that's how I'm going to confirm the right patient. So I'm going to start with my oral medication, which is metformin. So I've got my pill, I've got my cup, and I've got my sticker. So I have metformin, 500 milligrams, PO. This is a tablet, PO. Every morning, this is at 0800. I'm within my hour of 0800, and it's for Ashley Miller. I'm going to put my dot. That's my first check. Second check, metformin, 500 milligrams, PO, at 0800. It's 0800 on the 8th for Ashley Miller, and I have Ashley Miller. That's my second check. Third check, metformin, 500 milligrams, PO. It's a tablet at 0800. I'm within my hour window of 0800 on the 8th for Ashley Miller. That's my third check. I'm going to put my medication in the cup, and I'm going to be sure to put this in the cup when I'm done checking all my meds. I'm going to now move on to my injectable med. So I see she has fentanyl 50 micrograms IM. I know that I'm going to have to fill out a narcotic record because fentanyl is a narcotic. So on my narcotic record, I'm going to write 0800, the time I'm giving it. The patient is Ashley Miller. The doctor was Dr. Bluff. Her dose is 50 micrograms. And I see I'm going to take one fentanyl out. I would open the box and physically count. So I see there was 20. When I open this and take mine, I would count that there is 19 left. I'm going to write 19. I'm going to sign, and I'm going to have somebody else sign. I do see here that it's 50 micrograms per mil. So I know that she's getting 50 micrograms. So my med math would be dose ordered over dose on hand times the amount. So 50 micrograms divided by 50 micrograms times 1 mil, I'm going to give 1 mil of this medication. And it's a 2 mil ampule. So if I had 50 micrograms of waste, I would get that also signed by a second nurse. So that is the narcotic check, and that's just to keep the count. That was none of my writes or checks. So now I'm going to go through and do my writes and checks on my fentanyl. So I have fentanyl, 50 micrograms per mil, 50 micrograms, so I'm going to give 1 mil. It's going to be an IM, and it's at 0800. I'm within my hour of 0800. It hasn't been given, and it's for Ashley Miller. So that's my first check. Second check, I'm going to draw my medication up. So I've chose a 1 ml syringe because I'm giving half a ml. I have chose a 23 gauge 1-inch needle because I'm going to be giving this intramuscularly and I need it to get through the sub-Q tissue and into that heart of the muscle or the belly of the muscle. And I know that this will be a long enough needle at the 1 inch to reach the belly of the muscle. I've also picked a blunt fill filter needle because I'm going to be working with a glass ampule, so I need the filter to filter out any glass particles. I'm going to snap away from me. This goes into the sharps container. I'm going to open my syringe, ensuring not to touch the end or the plunger as that would break asepsis. I'm opening my needle, being sure not to touch the hub as that would break asepsis, and I'm going to connect the two together. Now I know that I need 50 micrograms, and this is 50 micrograms per 1 ml, so I'm going to draw up a ml of medication. I'm being careful not to touch my plunger as I pull down. I'm going to draw up my medication. And I have an air bubble in there, so I'm just going to get the air bubble out. Go in an angle, push my air out, and I just need to draw up a pinch more. Again, being very careful not to touch the needle, not to touch the hub, and not to touch my plunger. All right, so now I've drawn up my ml of my 50 micrograms of fentanyl. I am going to use the scoop technique, being careful not to touch my needle and not to poke myself. And I'm going to do my second check. So I need my ampule and my needle when I do this. Okay, so I'm going to look at the ampule for the right drug. So fentanyl, 50 micrograms. This is 50 micrograms because it's 50 micrograms per ml. IM, this is going to be an injection at 8 o'clock. I'm within my hour of 8 o'clock, and it's for Ashley Miller. That's my second check. Now I'm going to switch my needle out. Again, being very careful not to break asepsis, not to touch the blue hub. And my blunt filter is going to go into the sharps container. So this is the needle I'm going to inject with. So I'm going to again look at my ampule for the right drug. So I have fentanyl, 50 micrograms. This is 50 micrograms per ml. I have 1 ml. IM, this is an IM needle. Once daily, this is at 8 o'clock. I'm within my 0800 window. On the 8th for Ashley Miller. That is my third check. At this point, I can fill out my medication label and attach it to my syringe because I can't do my checks off of this. I need to make sure that I'm doing them off the ampule and the MAR. So I could attach a syringe there. All right. This is where this would go into the sharps. I'm done with my 3 writes and checks. It can go into the sharps, and if there's waste, another nurse would witness that. Now I'm going to take my pill, my injection, and my sticker so I can identify my patient when I go in the room to Ashley Miller's room. So I would go to my client. I'm going to do hand hygiene before I go into the client's room. And I'm going to go in and talk to the client. So hi Ashley, my name is Connie. I am the practical nurse that's working with you today. I have some morning medications for you. So you have metformin and fentanyl. Do you have any questions about those? She's going to say no. And I'm going to say, I just need to confirm with your wristband. So I'm going to take my sticker and compare it to the client's wristband. I'll move this over so you can see. So I have Ashley Miller, the date of birth matches, the PHN matches. So I know I've got the right client. I note here that she has a cefazolin allergy, which I noted before when I was transcribing, and I realize I'm not giving any cefazolin. I'm giving fentanyl and metformin. All right, so I would open my oral med, drop it in the cup, hand it to her with some water, have her swallow. How did that go? Did that go down okay? She's going to say yes. All right, now I'm ready to give you your fentanyl. I am going to give her fentanyl in her ventrogluteal. You could do it in the deltoid, the ventrogluteal, or the vastus lateralis. And you need to talk through how you would landmark for each of those. So explain how the landmarking would work. So I would landmark correctly. I would place the palm of my hand on her greater trochanter, my thumb pointing towards her groin, my fingers reaching for the iliac crest. I'm going to spread my fingers and it's going to go right in the meaty part. I would open my alcohol swab. I'm going to clean with friction for 30 seconds in a circle motion for the full 30 seconds. I'm going to allow that to air dry without waving or blowing on it. Okay. Once it's dried, I am going to uncap my needle. I'm going to Z-track or pull laterally on the tissues. I'm going to use a darting motion and dart into the skin. I'm going to stabilize and I'm slowly going to inject the fluid. So over about 30 seconds, I'm going to hold it there for a second. I'm going to come straight out the way I went in, release my Z-track and pop my safety. This is going to go into the sharps. And I'm going to ask the client if she needs anything else. At that point, I'm going to leave the room. I'm going to come back and I'm going to observe the right reason and right documentation. So she's on metformin for her diabetes and she's on fentanyl for pain control. So she has diabetic neuropathy pain and you can find that right on her doctor's orders. So she has some neuropathy pain and that's what the fentanyl is going to be for. And her metformin is for control of her type 2 diabetes. My right documentation is going to be initialing over top of my 3 dots. As I was there, I know that she took the medications. And that would have things done. I hope that helps clear it up for you, where some of the disconnects were. If you still have questions, you can bring those up during our meeting or during your redo time. All right, so please reach out if you guys have questions. I just wanted to send this out before you go to clinical just to kind of paint a clear picture. Thanks.